of the examining board. My name is Aurea Oscar Hunkia. I'm 20 years old, and I was born at Ivory Coast in Abidjan, but my native village is Saoué, so I'm Beninese. About my job, I'm a medical doctor, and I work in 2 hospitals. I work full-time and I earn a good salary. Concerning my interests, I love playing basketball and I love watching TV. I'm good at playing drum and cooking. I'm fluent in French and a beginner in English, but my English is improving well. As regards my marital status, I'm happily married and I have a very beautiful daughter. A medical doctor, often referred to as a physician or to a doctor of medicine. He is a licensed healthcare professional who diagnoses, treats, and provides medical care to individuals suffering from various illnesses, diseases, injuries, and disease or health conditions. They are extensively trained in medical science such as anatomy, physiology, geriatric, pediatric, among others. Medical doctors diagnose and treat various illnesses, diseases. They are responsible for taking medical history, conducting examination, prescribe medication, follow up the patient. I have to say that those roles or responsibilities can vary depending on their setting, healthcare, or their specialization. And we can describe 2 roles. In first time, when we take a medical consultation, medical doctor often provide consultation to others, healthcare professionals such as nurses, physician assistants, and others doctors. They can offer their expertise, their guidance, and their recommendation to some exceptional cases that require their specialized medical knowledge. And when we take the disease prevention and health promotion, medical doctors play a crucial role in educating patients about on preventive measures and promoting a healthy lifestyle. They can provide guidance on vaccinations and screening and advice on changed lifestyle. General practitioners can work both independently and collaboratively with others healthcare professionals such as nurses or specialists, depending on the healthcare setting or specialization and depending on the personal practice preferences. I can describe few scenarios. In first time, about independently practice, some doctors may choose to work in private practice, where they operate as the sole healthcare provider. In this setting, they handle patient care independently, managing all aspects of medical practice, including consultation, examination, diagnosis, and the treatment and to-end follow-ups. In second time, about hospital-based practice, some medical doctors can choose to work in hospital with others healthcare professionals, such as nurses, such as others specialized in a multidisciplinarity. In this setting, they may be involved to provide primary care to hospitalized patients or managing outpatient clinics within hospitals. Medical doctors follow some steps. In first time, they begin by taking medical histories. They ask about patient symptoms. They ask about all information concerning the patient, such as his name, his age, his previous illnesses, his allergies, and his family's medical histories. And then medical doctors do physical examination to assess patient global health, to assess vital signs, and to access to specific symptoms. By the way, they can use some techniques such as observation, palpation, auscultation, percussion, and after that, medical doctors can make a diagnosis. They can make a formal diagnosis or a preliminary diagnosis, or they can make a list of possible diagnoses. And if they are not very sure, they can continue by ordering and interpreting some diagnosis tests, such as blood analysis, biopsies, X-ray, electrocardiogram. Once a diagnosis is established, medical doctor can develop treatment plan, including medication, including therapies, life changes, lifestyle modification, or simply referral to the specialist. About the medication, doctor can prescribe some medications. They can prescribe some medication, and they can prescribe also therapy. They can choose to provide a non-pharmacological therapy. They can choose to prescribe some lifestyle modifications, such as do some exercise, diet, stop smoking, and they can refer to a specialist where they are not able to treat well the patient. And to end in, doctor will do the follow-ups of the patient. In Benin, we have our healthcare system is marked by a lack of resources, both in material terms and in terms of nursing, professional, such as doctors, nurses, and midwives. We are short-staffed, and it is exceptionally in the big cities like Cotonou, Ouida, Porto-Novo. There are many more doctors and specialists. But already when we go from the center of the country to the north, we notice a crucial lack of doctor in general and professional and, specialized in particular. And we really need of a health system, a health insurance system, which is open to everyone. That means that we can be sick and want to take care of ourselves and not be able to do so due to a lack of financial resources. Even if there are some insurance health system, it is not very well popularized. It may remain much more to a certain social class. But we have to say that our health system is flourishing. In Benin, we have a greater facility to be able to reach to a doctor or to be able to have information in medical field. We have also several clinics, we have several clinics meeting international standards that are building. And we have several partnerships established with doctors from outside to train those from here. And it is very important to mention that in this year, 2023, the Beninese health system experienced the opening of training school in pneumology and gastroenterology. I was very impressed and interested by the courses. The class lessons were very good, and we had the possibility to talk about everything, lots of common expressions. And the most important for me is that with EBP, my English skills have improved a lot. And before this training, I was not really able to talk or to speak, like this. I was not really able to make a very good description of myself. However, thanks to EBP, I can do more than those, and with EBP, I enjoyed learning English. I know it on the net, yes, on Facebook. I think that I have to improve in many skills, such as pronunciation, such as learning many more words, and yes, I think it.